Okay, one of the reasons why we treat diabetes is to prevent heart attack. First, okay, remember diabetes is one of the main factor for those who develop heart disease or heart attack. So basically, if you take medicine, you lower down the risk. But on the other hand, you must make sure that you take the medicine, your diabetes been controlled according to the target. So no point just having diabetes, take medicine. If your diabetes is not controlled, you can still get heart attack. Yeah. So, and then the other thing is that for those who have heart attack, they have been underwent, this angioplasty, balloon and stenting. They have a bypass been done. One of the factor that can cause earlier failure of this angioplasty, re-narrowing of the stent, the blockage again of the bypass, operation graft, is because of uncontrolled diabetes. So that's a message. If you are diabetic, okay, not to worry, follow diet, exercise, take your medicine, but you must make sure that your treatment adjusted by your doctors or physician or cardiologist meet the target. Like, for example, we have our regular, we must make sure our fasting blood sugar always below 6.1 millimole per liter. We do the every 3 months HbA1c, to see the average sugar. Best is to get it below 6.5%. So this must be discussed with the attending doctors who manage those who are having diabetes. Not necessary. You know why? Because first, as I mentioned earlier, if you belong to those who have family related or genetically related high cholesterol, which is about 20%. Okay, to be fair, we know that high cholesterol is one of the risk factors for coronary artery disease, yeah. But then most of this actually lifestyle, 80%. But there are 20% of people that even though they are thin, they have an ideal body weight, they run every day, if they have to check their cholesterol. Because if they have a high cholesterol, especially the bad cholesterol, LDL, they are at risk getting premature or early heart attack. So even though they are thin, they run every day, they must make sure they know their cholesterol level. Because if their cholesterol level is high, related to genetically or family link, despite exercising, despite the dieting, the cholesterol will not be lowered. So they have to consult their physician or cardiologist, and most of the time, we will prescribe their medication. Okay, this word old is very subjective, but what I'm trying to say that, okay, maybe people say that veterans are those who are over 65, but actually, this is a very interesting question, because, of course, the risk of getting heart disease is higher as you age. Why I say this question is very relevant. This country, among the Asian country, ASEAN country, compared to our neighbor, like Singapore, Thailand, we Malaysians tend to get heart attack earlier than them. You ask me why? I cannot answer the question. We have to do more research, possibly due to our lifestyle, our diet. We got a very interesting cuisine in the country, merge of 3 cultures, the Malay, the Indian, and the Chinese. So maybe we have to look at that. Not necessarily true, but this is the issue that, meaning to say, among these 3 neighboring countries, we are the one having earlier heart attack.